Pregnancy symptoms at 4 weeks. What are the pregnancy symptoms at 4 weeks? Fourth week of pregnancy is the first half of the first trimester. The symptoms during this week might go unnoticed as not many changes are observed in the body. These symptoms resemble premenstrual syndrome. In many cases, a woman might not experience the symptoms although the baby goes through the initial developmental stages. At 4 weeks, the changes are often negligible, and women often ignore that fact of being pregnant unless the symptoms of pregnancy become prominent. Symptoms. The first thing you will observe during the 4th week is missed periods. If you do not get your periods during the first month, get a pregnancy test done using a pregnancy kit. If the indicator shows a positive result, then you are pregnant, or else a missed period can be due to some other reasons. Tender and sore breasts is one of the common symptoms of 4th week pregnancy. Nausea and vomiting during the morning hours will also be experienced. You will feel extremely tired even if you do not undergo any physical exertion. Abdominal bloating, similar to the one experienced before periods, will also be observed. Apart from morning sickness and other physical changes, the body undergoes several changes internally. During this period, the level of human chorionic gonadotropin, HCG, increases. The hormone sends a signal to the ovary to stop releasing further eggs, and implantation of the fertilized egg takes place inside the uterus lining. This occurs immediately after successful fertilization. You might observe spotting, known as implantation bleeding, after 3-4 days of implantation. After implantation, the egg develops into a fetus, and growth of the baby takes place eventually. If you get an ultrasonography done, you can observe how your baby is maturing inside your womb. At 4th week, the baby is still very small. It normally grows to a size of about 0.014 to 0.04 inches. It derives nourishment from the secretions of the uterine lining. The amniotic cavity gets filled with fluid. Exchange of nutrients and oxygen take places through the placenta, providing nourishment to the embryo developing inside. The cells get specialized according to the function. The inner layer of the cells form the digestive organs and the respiratory system. The outer layer is specialized to form the nervous system, hair, and the skin. The middle layer of the cells become the sex organs, muscles, circulatory system, cartilage, and the skeletal system. You might not experience the changes externally, but your baby is growing gradually inside your womb. The signs of pregnancy become more prominent with passing weeks. Sometimes, the symptoms are confused with premenstrual syndrome. However, if your instincts say that you are likely to be pregnant, then the best thing is to get a pregnancy test done. The presence of HCG in urine confirms that you're pregnant. Mood swings will begin, and the intense urge to grab food will surely grip you. Be ready to face the unique experience and celebrate the joy of giving birth to your child.